All right, so today we're diving deep into something I think we all hear a lot about, but maybe don't always connect all the dots on, and that's exercise and how it impacts your heart.
You always hear exercise is good for you. But what does that actually mean?
Yeah, and especially because I think a lot of people worry, like, what if I have heart issues already? Is exercise actually safe?
Right, that's such a big question.
And thankfully, that's exactly what we're diving into today. We're
Yeah.
looking at this video he's a consultant cardiologist, so, he knows what he's talking about.
Yeah, he does. And he actually makes a really bold claim that I found super interesting.
Oh, really? What is that?
He basically says the benefits of regular exercise can actually outweigh those of many medications.
Hold on. More powerful than medication. Now, that's a claim.
It is, right? It
Wow.
sounds crazy.
What makes him say that?
I think about it. A lot of medications, they're managing symptoms, but exercise actually strengthens your heart muscle, improves your blood flow, and even helps your body regulate things like blood sugar and blood pressure.
So it's not just masking the problem, it's actually addressing the root cause.
Exactly. It's almost like you're training your body to function better from the inside out.
That's pretty incredible.
Yeah. And he really emphasizes this idea that your heart can actually talk to you, letting you know if you're pushing too hard.
Wait, what? The heart can talk. How so?
He uses angina as an example. Angina is that chest pain that can happen when your arteries are narrowed.
Right, yeah.
So if you're feeling that during exercise, he's basically saying it's your heart saying, whoa there, partner, let's dial it back a bit.
Okay, so it's like a built-in warning system. That's kind of cool. But what if you don't have angina? How do you know if you're pushing too hard?
He talks about listening to your body and gradually increasing how intensely you're exercising and how long you're exercising.
Right, don't go from 0 to 60.
Yeah, exactly. Don't go from couch potato to marathon runner overnight.
Yeah, right. That makes sense. He
Yeah.
actually uses that as an example, someone trying to run a marathon with no training.
Yeah, he calls that unaccustomed exercise.
That's the perfect name for it.
And it could put a lot of strain on your heart, especially if it's not used to that level of work.
And then there's this whole 9-minute treadmill test he talks about.
Yes, that one caught my attention too.
What is that about?
So apparently, if you can exercise for 9 minutes straight on a treadmill without having to stop, it's actually a pretty good indicator that you've got good heart health.
Wait, really? Just 9 minutes?
I know, right? It seems almost too easy.
It does.
But he says that being able to hit that 9-minute mark is actually linked to a lower risk of heart complications, even for people who already have heart conditions.
Really?
It's like a benchmark for how resilient your heart is.
So it's not just about how long you can exercise, it's about how well your heart can handle it.
Exactly. And he actually says that exercise can be like a natural anti-inflammatory.
Wait, anti-inflammatory? I think of Advil or something you put on a sprained ankle when I hear anti-inflammatory.
All right.
What does that have to do with exercise?
Okay. Well, he talks about how inflammation is actually at the root of many chronic diseases, including heart disease.
So it's not just about strengthening the heart, it's about creating a healthier environment inside your body.
Yeah, it's like there's this constant fire smoldering in your body, and exercise helps to kind of put out the flames.
Oh, okay, that makes a lot more sense now.
So it's not just about those big muscles. It's about a healthier internal environment.
All right, so we've touched on a few of the conditions he covers, but I definitely want to dive deeper.
Yeah, me too. Let's get specific and see how this all actually plays out in relation to things like diabetes, high blood pressure, even heart attacks.
Let's do it. Okay, so we've heard that exercise can be like medicine for your heart. But let's get into the nitty-gritty. What about those of us with specific conditions like diabetes?
He dives right into that one.
Yeah.
It turns out exercise actually plays a huge role in how your body handles sugar.
Which is like the core of what diabetes is all about.
Exactly. So it all comes down to insulin, right?
Insulin, that's the hormone that helps your body use sugar, right?
Yeah, it's like the key that unlocks your cells and lets the sugar in.
So if insulin's not working properly, the sugar can't get into the cells.
Right, and it just builds up in your blood, which is not good. But exercise, it can actually help your cells become more sensitive to insulin.
So it's like exercise makes those keys work better.
Exactly.
Yeah.
And that helps keep your blood sugar levels more stable, which is essential when you're managing diabetes.
So it's not just about losing weight, it's about improving how your body actually processes sugar on a cellular level.
You got it. And he talks about hypertension too,
Oh.
high blood pressure.
Oh, yeah, that's another one I hear a lot about. So how does exercise help with that?
Well, high blood pressure puts a lot of strain on your arteries.
Yeah, all that pressure.
So think of your heart as a pump. And when you exercise regularly, it strengthens that pump.
So a stronger pump, a stronger heart.
Exactly. A stronger heart pumps blood more efficiently, which puts less pressure on your arteries.
So it's like exercise is giving your heart a workout to keep things flowing smoothly and keep your blood pressure in check.
You got it. And then he talks about heart attacks.
Yeah, okay, so that one's a little scarier.
It is, but the good news is regular exercise can help reduce your risk of having a heart attack.
Okay, that's reassuring.
Heart attacks usually happen when those arteries that supply blood to your heart get blocked by plaque.
Like a clog in the pipes.
Right. But exercise, it improves blood flow and strengthens your heart muscle, making it less likely that plaque will build up in the first place.
So it's like exercise is clearing out the pipes, A&D strengthening the system all at once.
Exactly. And even if someone has already had a heart attack, he says exercise can be a huge help in their recovery.
Oh, really? How so?
Well, it helps improve circulation, of course, and it also strengthens the heart, which supports the whole healing process.
It's like exercise is giving the body the boost it needs to bounce back stronger.
Exactly. So prevention and recovery. And he also talks about heart failure.
Heart failure. That sounds pretty intense.
It is. It's a serious condition. But the good news is exercise can actually help improve heart function.
So like those stories we were talking about earlier of people coming off the heart transplant list.
Exactly. A lot of those were people with heart failure, and through exercise, they were able to strengthen their hearts.
Wow, so their hearts were failing, and exercise actually helped them get strong again.
It can. Exercise helps the heart pump blood more efficiently. It reduces fluid buildup. It can really improve quality of life for those with heart failure.
That's amazing. It really shows how powerful exercise can be. What about arrhythmias, those irregular heart rhythms?
He covers those too, specifically atrial fibrillation, which is a pretty common type.
Okay.
And it turns out exercise can actually help regulate your heart rhythm.
So it can help with that too. That's incredible. But you know what? I'm still a little fuzzy on this whole anti-inflammatory thing.
Yeah, we talked about that a bit earlier, right?
We did, but I need a little more clarification. What does it actually mean in real life?
Okay, so inflammation, if your body's natural response to injury or infection.
Right, so like if you get a cut and it's all red and swollen.
Yeah, exactly. That's inflammation, your body working to heal itself.
So how does it become a problem?
Well, sometimes inflammation sticks around even when there's no injury to heal.
So it's like your body's alarm system is just going off all the time, even when there's no real danger.
Exactly. And that's what we call chronic inflammation. And that can be a problem because it can contribute to all sorts of health issues, including heart disease.
Ah, okay. So that's where exercise comes in.
Exactly. Exercise helps regulate your body's inflammatory response. It's like turning down the volume on that alarm system.
Okay, so it's bringing things back into balance.
Exactly.
This is all really fascinating stuff. It seems like exercise is way more than just sweating it out at the gym.
I know, right?
Yeah.
It's a fundamental way to take care of our hearts and our overall health.
And the coolest part is we all have access to this incredible tool.
That's the best part.
But before we get too carried away, remember, it's always a good idea to talk to your doctor before starting any new exercise program.
Absolutely. Especially if you have any pre-existing conditions.
Definitely.
Well.
But I think the main message here is incredibly hopeful. Exercise is powerful. It's something we can all do to improve our health.
I agree. It's a reminder that our bodies are amazing and resilient, and we can make a difference.
Okay, well, stay tuned because we're going to wrap up this deep dive with some final thoughts in just a bit. Okay, so we're back for the final part of our deep dive into exercise and the heart. I don't know about you, but I am ready to get moving.
Me too. It's funny how just talking about exercise can make you want to go for a run or something.
It really is. So before we wrap things up, let's do a quick recap of what we've learned from this cardiologist.
Sounds good.
So the biggest thing that stood out to me was that exercise isn't just about aesthetics. It's not just about fitting into your jeans. It's about living longer and healthier. And the fact that those benefits can be even more powerful than some medications, that's pretty incredible.
Yeah, that blew me away too. And he was very clear that it doesn't have to be these crazy intense workouts either.
Right, like who has time for that anyway?
Even moderate exercise, going for a walk, gardening, those things can have a big impact on your heart.
Yeah, it's about making movement a part of your daily life.
Exactly. And one of the things I found really interesting was the idea that exercise can actually help your heart become more efficient. It's like giving your body this tune-up from the inside out.
It's like you're training your body to use oxygen more effectively. Speaking of which, remember how we talked about that at the end?
Yeah, the whole oxygen delivery thing.
Yeah, he said something like, what if we thought about exercise not just as moving our bodies, but as a way to fuel our system with oxygen?
I love that.
Yeah.
It really changes your perspective on exercise. It's not just about burning calories. It's about giving your body the energy it needs to thrive.
It's about feeling more alive, more energized.
Exactly. And he also talked about the importance of listening to your body.
Yes, and starting slowly, especially if you're new to exercise.
Right. It's a journey, not a race.
And we learned about all those different conditions that exercise can help with. Diabetes, high blood pressure, even heart attacks.
Right. And that whole anti-inflammatory thing.
Oh, yeah, that was a big one. Exercise helps reduce that chronic inflammation that can lead to so many problems.
Exactly. So the takeaway here is movement is medicine. It's a powerful tool that we all have access to.
It's about taking control of your health and doing something good for yourself.
Absolutely. Find something you enjoy, start gradually, and listen to your body.
And as always, it's a good idea to talk to your doctor before starting any new exercise program.
Definitely. But most importantly, remember that your body is incredible. It's resilient, and it wants to be healthy.
So get out there, move your body, and experience the incredible power of exercise.
Thanks for joining us for this deep dive. We'll see you next time.